As Ohio's economy starts to reopen, workers' advocates are fighting for more protections. News 5's Olivia Fecteau lays out their demands.
For many workers making barely above minimum wage, it was tough enough before COVID-19 hit. But now they say it's gotten even tougher.
Life is still going on. We still have to survive. Bills are still accumulating.
Tanisha Head was laid off March 12th from her job as a restaurant hostess at the Hilton in downtown Cleveland. She's been unable to access unemployment because the system is so overwhelmed.
So basically, it's just been a waiting game.
She's worried about how to manage during this time and feels there should be better protections for all workers.
This is not a matter of race. It's not a matter of class.
According to Policy Matters Ohio, more than half of Ohio's 10 most common jobs are also among its lowest paid.
Too many Ohioans were already barely getting by. We've seen that for the last several years, and that was before the pandemic struck.
Researcher Michael Shields says many of those workers are also among those most exposed to the virus, including some healthcare workers, cashiers at grocery stores, and fast food workers.
We need to make sure that those workers and also workers who are going to be rejoining them as we start to reopen parts of our economy are safe when they get back to work.
Advocates propose 4 policies they say would help. Workplace safety, a minimum wage that reflects cost of living, quick distribution of unemployment benefits with permanent eligibility for more workers, and paid sick leave for everyone.
I think it's important for workers to have paid sick leave so they don't feel obligated to go to work just to support themselves when they're sick.
Dr. Ash Sagel is a professor of medicine at Case Western Reserve University. He says what we've learned about COVID-19 can help inform policies to protect workers.
We've learned that it can be transmitted by people who are asymptomatic. We've learned that it can be transmitted through shared surfaces. And we've learned that it can be transmitted through droplets that are created when somebody who's infected coughs or sneezes or even talks.
Tanisha Head believes it's time to take workers seriously.
I believe that it should not matter how much money you make because it's hard enough as it is to work a job that barely pays enough without the COVID-19 stuff going on.
Dr. Sagel says people must take public health recommendations seriously to protect all Ohioans. Otherwise, he says we'll see a surge and could even see a spike in new cases. Reporting in Cleveland, Olivia Fecteau, News 5.